Now, we hear a lot about viruses. What exactly are they and what do they do? Now, there are different bugs in the environment that cause illness. Viruses are the most common. Others include things like bacteria, parasites, and other bugs out there. Viruses are exceptionally common in kids. They're spread very easily, and their immune system isn't quite developed enough to fight them off. So up until primary school age, it's really common for kids to get viruses back to back all year long, particularly if a child attends childcare, because viruses are spread so easily in a childcare setting. Now, viruses are spread often by saliva or bodily fluids, which is why kids pass them on very easily because they slobber on everything. And then other viruses, such as those that cause gastro, are spread by other bodily fluids, such as vomit or in their poo, which is why hand washing is very important. The current virus that we've all heard about, coronavirus, is a respiratory virus, so it is spread by droplets in the air. The symptoms that the virus gives your child depends on where the virus is. So for example, upper respiratory viruses such as a common cold can cause any symptoms such as cough, runny nose, blocked nose, sore ears, sore throat. They're very common and spread very easily. Other viruses, such as a gastrovirus, can cause vomiting, diarrhea. There are viruses that can impact the voice box, causing a condition called croup. Viruses that cause rashes, such as chickenpox. So as you can see, the symptoms can be so varied. The main thing for parents to note about viruses is the following. First of all, we can't treat viruses. Antibiotics treat bacterial infections, so unfortunately, most of the time with the viruses, there is no treatment, it's just time and riding it out. But what you can do is support your child through the virus. So things like paracetamol and ibuprofen, if the child is miserable with a fever or in pain with a sore throat or sore ears, they can be really helpful medications. With sore ears and sore throat in particular, that can be quite painful, so it's really important to make sure we're keeping on top of their pain. This is also important because if their pain is under control, they're much more likely to drink, and keeping up their fluids is crucial for viruses. It's in fact the most common reason why children end up in hospital is when they're not eating and drinking. And just like adults, we feel tired and we don't really want to do much when we have a virus. Children can be a bit more lethargic than usual, and they can get quite clingy and need lots of cuddles. So making sure you're around for that can be very helpful. The other important thing to do is to watch out for any concerning symptoms, as mentioned before in the fever chat. I'd also get them checked every couple of days if it continues, or if there's anything that changes with the symptoms. And of course, if at any point of time you are worried, you should get your child reviewed. No one knows your child like you do.